In the spring of 1999, The Guardian reported the heist helicopter rescue on Mount McKinley. Among those saved was Nigel Vardy, later nicknamed Mr. Frostbite after losing parts of his face, fingers, and toes. Frostbite can affect anyone, skiers, outdoor workers, or even students walking on a freezing morning. It occurs when skin and tissues freeze due to extreme cold. The development of this speech involved a meticulous analysis of the data collected during the research phase from its scholarly resources. Understanding its causes, risk factors, and prevention is vital. In this speech, we will cover the underlying causes, associated risk factors, and the essential preventive measures of frostbite. After getting familiar with the main points and what's in store for us, let us dive into one of the things you have to remember about frostbite. First, let's talk about the causes. According to Linda Jackson, the author of Quick Response to Hypothermia and Frostbite, cold exposure causes blood vessels to narrow, reducing blood flow to fingers, toes, ears, and nose. Number two, the authors of The Physiological Response of the Body to Low Temperatures stated that without warm blood, extremities cool to sub-freezing levels, damaging tissue. Number three, the authors of Out of the Cold, Management of Hypothermia and Frostbite wrote that wind chill removes skin moisture, forming ice crystals inside and outside cells. 4. According to George T. Chiampas, a professor and an emergency medicine doctor at Northwestern Memorial Hospital in Chicago, exposed skin can freeze in as little as 5 minutes. In short, vasoconstriction, the narrowing of the blood vessels, helps conserve heat, but prolonged restriction causes tissue death. After learning about the causes, let us slide into the risk factors leading to frostbite. Here are some risk factors for frostbite. Number 1, according to an article from the CDC's website titled Preventing Frostbite, poor circulation, inadequate clothing, or prolonged exposure to cold temperatures increase susceptibility, especially for the elderly, homeless, hikers, and infants sleeping in cold rooms. Number 2, the author of How Severe is This Frostbite, Sullivan, mentioned that illness, injuries, or conditions like excessive sweating raise vulnerability. An example of the injury part is that my affected hand, this one, is colder than the normal one when exposed to lower temperatures. Having gone through a traumatic injury in the past, this is a result of the ulnar nerve damage disrupting my body's thermoregulation. Number 3, Sullivan also included alcohol and drugs, which impair judgment. It can increase risk, just in case you get into an accident and you can freeze to death. After examining the risk factors, let's move on to the preventive measures of frostbite. The following are steps in frostbite prevention. Number 1, layer clothing with insulating and wind-resistant materials. Number 2, stay dry. Bring extra clothes and wear protective gear like hats, scarves, and mittens like this one. Number 3, plan ahead. No personal triggers. Take breaks, stay hydrated, and seek shelter when needed. Number 4, recognize signs. The early stage is commonly referred to as frostnip, exhibiting pale and numb skin, may advance to blisters, blackened skin, and loss of function. In summary, frostbite results from extreme cold but is preventable. Awareness of its causes, risk factors, and prevention reduces the risk of severe cold injuries. Climbing a mountain isn't the only danger. Even daily routines in freezing weather can lead to frostbite. As Stephen King once wrote, there's no harm in hoping for the best as long as one is prepared for the worst. Thank you so much.